I believe I am. The meeting is being live streamed. Got it. Okay, now it's doing some stuff. All right. Okay, now I have the, all right. It looks like it's working. So now I have to take this YouTube link. Okay, it opened up in YouTube for me. Great. I'm going to take my webinar, edit the web page right now. Okay, and then I'm going to delete this placeholder. All right. I'm just going to paste in the YouTube link there. Okay, it's thinking. I'm going to update. Okay, so I've saved it to the website. So now it should be working on the website.
Yes, I see it.
Great. So you see our so when you hit play, what do you see?
I just see NCMAA. That's it, nothing else.
Got it. Okay, good. So then, okay, so I've saved it to the website. Oh, that's me. So now Okay. So so I think we'll begin. أعوذ بالله اسمه من الشيطان الرجيم بسم الله الرحمن الرحيم. खुदा ताला अली का मुफल मौला ने उमर शरीफ ने तारोज क़यामत दराज and दराज कर जो. Everyone, Saga, welcome to the Seifi Brahani Medical Association of America, also known as SBMAA webinar. Thank you for joining us today. We are all here. So I think we'll begin. أعوذ بالله اسمه من الشيطان الرجيم بسم الله الرحمن الرحيم. खुदा ताला अली का मुफल मौला ने उमर शरीफ ने तारोज क़यामत दराज and दराज कर जो. Everyone, Saga, welcome to the Seifi Brahani Medical Association of America, also known as SBMA. So, we're having a slight technical issue here. Hold on a moment. Sorry. एक minute. I see. All right. Sorry about that echo, everyone. All right, let me start over here. So as I was saying, welcome to the Seifi Brahani Medical Association of America, also known as SBMA. We're here to learn about an important topic, which is usually not understood by many, but will probably be needed by a lot of people at some point in their lives. So, and that is specifically the basics of Medicare, or as we call it, Medicare 101. Let's just give you a brief introduction about SBMAA. But first, I want to mention that we are not providing any medical advice of any kind here. We're just sharing information. There's all this boilerplate, which you can ignore. During this presentation, we're gonna keep a phone number on the bottom of the screen. You can see it in green, in the green bar at the bottom on every slide. That's a WhatsApp message number that you can send any questions you may have during the presentation to that number. And the question should obviously be related to Medicare. And at the end of the presentation, we will then, our presenter will then go through those and answer a few of those as much as time allows. Okay. So now let me just go straight into discussing a little bit about SBMA. We were formed in 2015. We've done a number of initiatives, including Zafar Mullah and Niaz Imam Hussein during Ashura. We've had 2 conferences, both in Chicago, in 2019 and 2022. Inshallah, we'll have a 3rd conference in 2023 in Dallas. We've been conducting multiple webinars. We've had scholarships for healthcare students to attend Ashura with Mullah. We've provided medical equipment to Jamaats across North America. We've contributed towards different building programs, in India, and a few other initiatives that we're quite proud to have been a part of. This webinar is part of our series in different topics, and will be also shared to our YouTube channel, youtube.com/@sbmedical.org. /@sbmedical, or our website, sbmedical.org. So let me introduce our presenter. Insia Ben Badri was born and raised in Chicago and currently resides with her family in Los Angeles. She's a licensed agent with extensive experience in Medicare. She has a whole team of people that can help you with joining Medicare and finding the right plan and maximizing your benefits. As she puts it, she cuts through all the noise for you. So with not any further ado, I will just hand it over to Insia Ben and let her teach us about Medicare. So Insia Ben, you might want to go ahead and unmute yourself. I'm going to mute myself.
Shukran, Aziz Bhai.
Insia Ben, we can't hear you.
Hello?
Try
Can you
now.
hear me? Hello?
Nope.
Hello? Hello?
Let's see. But Huh. I don't hear you. Does anyone
Hello?
else? Let's see if that's.
Okay, it seems as if Alethea Alcamri says she can hear me.
Oh, great. Okay. Sorry. I think that you're good now. Go ahead.
Okay. All right, great. So पहले अपने first of all, thank you so much, Aziz bhai. Think अपने खुदा ताला ने शुक्र करिए कि आका मौला तवाला अमर शरीफ ये अपना लिदे सेफी बुरहानी मेडिकल एसोसिएशन कायम किया छे ताकि मोमिनीन ना हेल्थ ना उम्र सेहल थाय. And I shukran to all the SPMAA organizers who helped set this up for us. And I shukran tame sagla je aya che, je hazir thaya che. Bismillahirrahmanirrahim. Again, my name is Insia Badri, and I am a licensed health agent for, I'm licensed in California and Illinois. And I'll be going over some information today that will be helping these type of people. People who are turning 65, people who are older than 65 but losing insurance from their employer, anyone who is unsure about whether to keep their employer insurance or enroll in Medicare, and seniors that are unhappy with their current coverage, and anyone who is on Social Security disability. Next slide, please. I'll be covering the ABCs and Ds of Medicare. Next slide. So first, I'd like to talk about what Medicare is. There's a lot of misconceptions. So Medicare is a health insurance program that's provided by the federal government. It is for US citizens and legal residents, and it is considered an individual health insurance. Medicare is not what a lot of people confuse it to be as Medicaid, or what they call it in California as Medi-Cal. Medicaid is a state-funded program, whereas Medicare is on a federal level. Medicare is also not Social Security. Many people confuse this because you are eligible for Social Security benefits and Medicare benefits at the same time, and you apply for both of these benefits through the same website. However, you can get Medicare and delay your Social Security. Also, vice versa, you can get your Social Security and delay your Medicare. So it is not together. They're two separate things. And lastly, I'd like to talk about how Medicare is not a family plan. If one spouse is on Medicare and it does not qualify the other spouse to receive Medicare benefits. The Medicare card looks like this, the red, white, and blue card showing your name, your Medicare number, and your Part A and B effective dates. Next slide. Now, who can get Medicare? There are mainly three ways you can get this federal health benefit. The first and the most common way is that if you're within 3 months of turning 65, even if you're working, you can get Medicare insurance. It'll just be used as your either primary or your secondary insurance, depending on your employer. And if you're under 65, you can qualify if you have a qualifying disability, if you've been on disability for at least 24 months. The third way is if you have end-stage renal disease, that's ESRD. Next slide. Now, what does original Medicare cover? I'll keep saying the word original Medicare because I want to make sure you understand that original Medicare is not associated with any kind of private plan. So original Medicare consists of Part A, which is hospital insurance, and Part B, which is medical insurance. Part A, hospital insurance, covers things like hospital rooms, skilled nursing facility, hospice care, operating room services, and so on. Part B, on the other hand, is for things such as doctor visits, outpatient care. You're gonna lab services are included in that, ambulance services, therapy, and wellness visits. Next slide, please. So now that we've covered what's included in Medicare benefits, I'll talk about a little bit about things that are not included in Medicare, but things that we still need. So Part A, which again is hospital insurance, and Part B, which is medical insurance, still do not cover these following things. So 20% of the cost of your care, prescription drug coverage, which is considered Medicare Part D, and I'll talk about that later. It does not include an annual physical, Now, Medicare does include and cover a annual wellness visit every year, but it is not a physical exam. It just includes a health risk assessment and a cognitive assessment. Medicare also does not cover dental, vision, hearing. That includes like hearing aids, eyeglasses, contacts. None of this is covered through Medicare. Medicare also doesn't cover long-term care and a lot of care outside the US. Medicare is mainly in the US. If you travel outside, you will have to get traveler's insurance to cover it. Next slide, please. Now, what does original Medicare cost? So Part A, if you or your spouse have worked over 40 quarters, or they say 10 years and paid into the Social Security benefits, then your Part A premium will most likely be $0. Otherwise, it'll be $499 a month. That's a monthly premium. Premium is a monthly payment that you pay to get the health coverage. Now, although most people have Part A for free, there is a deductible of $1,600 per benefit period. A deductible means that you have to pay this amount, the $1,600, before the insurance will start covering anything else. After the $1,600 is paid, Medicare will cover the first 60 days. So now I say benefit period, usually a deductible is for the whole year, but in Part A, it is the first 60 days between hospitalizations. So I'll give you an example. It's a little bit confusing. If you go into the hospital, say in January, and for some reason, and you stay for 5 days, you will have to pay, you will be responsible for paying $1,600, which is the deductible. The rest of the stay is free. However, if you go back into the hospital 4 months later, or anytime after 60 days, you will be in a new benefit period. Hence, you will have to pay the deductible again. You won't have to pay the deductible if you're hospitalized within the 60 days of being remitted. Part B, medical insurance, has a premium of $164.90 for the average income earner. It does have a smaller deductible, which is of $226 per year. And after this deductible has been paid, Medicare will cover 80% of the cost, and you will be responsible for 20% of all the Medicare approved services. So just note that if the Part A premium will be free if you or your spouse worked and paid taxes for 10 plus years. And if you are above an average income earner, then you'll have to pay a higher Part B premium. Next slide, please. So as I mentioned, if you have, if your individual tax return shows as an individual that you're earning more than $97,000, or as a joint more than $194,000, then you'll be paying more than around $165 per month for your Part B premium. And as your income goes up, your premiums will go up according to this chart. And this is all based on your 2021 yearly income for 2023 benefits. So it goes back 2 years. All right, next slide, please. Now we're going to skip Part C, because we talked about Part A and we talked about Part B. We're going to skip Part C and we're going to talk about Part D first. Medicare Part D is prescription drug coverage. Now, how Part D works is that you have another monthly premium that you pay an average of about $30 to $33 a month. And that's again for an average income earner. And then you have copays for each medication based on its tier. There are 5 tiers, with the lowest copay being in tier 1 and the highest copay being in tier 5. You may also have a deductible depending on your plan. And you may also have to use a specific pharmacy network. Next slide, please. So as I said before, like how Part B is the premium is determined. Part D is similarly in that way. If you make more than 97,000 a year on your tax return as an individual, or more than 194,000 on a joint tax return, your plan premium will go up according to this chart. All right. Now a little bit more about Part D. So I won't dive into the coverage stage for Part D in depth, but I do want to point out a few things here. There's 4 stages that I want to talk about in Part D. There's an annual deductible, which is again the initial amount that you have to pay before the insurance starts paying. Then you go into an initial coverage stage, which is when the insurance kicks in and starts paying for, and you start receiving the benefits from the health plan. Then you'll get into the coverage gap. Coverage gap is also known as the donut hole. Donut holes it's where when people will fall into this area if they're taking very expensive drugs, and their out-of-pocket costs will reach. The total drug cost will reach over $4,660. So if the insurance company is paying more than $4,660 for your drugs, at that point, the insurance company will stop paying for your drugs and you'll get into a donut hole. And in that, you'll be paying a different amount for your drugs. It's a higher co-insurance. And then you'll get into catastrophic coverage as the last stage, which is basically once you have paid about $7,400 out of pocket for drug coverage alone, then the insurance will come back in again and start paying for your drug costs and the catastrophic coverage. In each stage, you'll be paying different. I mean, the idea is you'll be paying different amounts in each stage of your drug plan. So that was what my essential point is. And on the bottom, it shows the 5 tiers, with the preferred generics being the cheapest in tier 1. And as you go down to generics, then preferred brands, and then brand name drugs. And then tier 5, you can see is a specialty drug, which are usually extremely high cost. All right, next slide, please. So we talked about how original Medicare gives us basic coverage, but it doesn't cover everything we need. And there are 2 options to get more coverage to cover these gaps. So one option is to get a Medicare supplement plan, also known as Medigap. This will cover all of your out-of-pocket costs, and it covers everything that Medicare covers. So you will also have to get a Part D plan, which is the prescription drug coverage. So you have option 1, where you get the Medicare supplement plus prescription drug plan. And then you have option 2. Option 2 is a Medicare Part C plan, which is Medicare Advantage. I know there's a lot of words that a lot of these are used interchangeably. So that's why I'm putting all the different names for these things. And Medicare Part C and Medicare Advantage are similar, are the same thing. So option 2 in Medicare Part C, it usually includes Part A, Part B, and Part D into one plan. And then on top of that, it may offer additional benefits such as dental, vision, and hearing. Okay, next slide, please. So I'm going to dive a little bit further into Medicare supplement plan. So the first option we talked about was Medicare supplements. The way this plan works is that if you pay a monthly fee in addition to your Part B premium, I just want to note in the last slide that you, with both options, you still have to pay Part B premiums. That will not go away. So anything you have to pay with Medicare supplement or with Medicare Advantage is going to be on top of your Part B premium. So that Part B premium you will have to pay regardless. The private plan covers the costs in original Medicare. So there are 8 plans that go by letters of the alphabet and are standardized by the government. So you'll have Plan N, Plan F, Plan C, and they're all offered by private companies. These costs vary by age and by company. So depending on your age and the company that you're going with, your average premium for these plans are between $200 to $300. You don't get, in these plans, you don't get drug coverage, dental, hearing, or vision benefits. But on the upside, there is no medical underwriting. Medical underwriting is when insurance companies check for pre-existing conditions, or they check your health status to determine how high your premiums will be depending on how much of a risk you are to the insurance company. So there's going to be no medical underwriting up to 6 months after you enroll in Part B. With the Medicare supplement, you also have guaranteed renewable, and you get nationwide coverage without being stuck to a provider network. But do note that if you live in Massachusetts, Minnesota, or Wisconsin, their plans are different from the standard. Next slide, please. Okay, so you can see here all the plans from A to N. Each plan covers a different amount of benefits. So you can see over here you have Part A, the hospital coinsurance, hospice care, medical coinsurance. So a lot of these cover the first half. The basic benefits are mostly covered by all plans. The additional benefits are covered by some, not all, and all the costs vary accordingly to how much they cover. Right now, the plan with the most coverage is Plan G. Plan C and F do have a lot of coverage, but they are no longer available for seniors who turn 65 after January 1st, 2020. Next slide, please. So the second option I talked about was Medicare Advantage. The way this plan works is if you are still in the Medicare program, and you have to keep paying the Part B premium, but all the extra benefits are offered by private companies. So this is the biggest advantage of a Medicare Advantage plan. These plans offer benefits like a prescription drug plan, routine and comprehensive dental, routine eye exams, glasses, hearing tests and hearing aids, fitness programs like a membership to the gym, chiropractor, and many even offer transportation to medical services. Most plans have a $0 premium, which is no monthly payment. You still have to pay the Part B, but you don't have to pay any premium for these plans. And a lot of them also have a $0 deductible, which means that this plan will take care of original Medicare Part A and B's deductibles. So the $1,600 that we talked about for Part A and the $226 for Part B, the Medicare Advantage plan will take care of. However, the downside is that you do have copays or coinsurance when you go to receive the services. With the supplement, you don't have any of that. Everything is covered. With this one, a copay is like a set amount that is determined by the insurance company to pay for certain services, such as if you want to go for a specialist visit, sometimes it's a $25 copay. Coinsurance, the difference between copay and coinsurance is a percentage of the amount that the patient has to pay, such as when you go to a specialist, you have to pay 20% of the cost. However, unlike plain Medicare, there is an annual out-of-pocket maximum. So there is a cap to how much you will be paying for the whole year. A negative aspect with a Medicare Advantage plan is that many of them are HMOs. And with HMOs, you may need to see your primary care doctor to get an authorization or referral to see a specialist. So you can't just make an appointment with a specialist and go whenever you want. You might need authorization. There are PPO plans popping up in certain regions now. Depending on your state and your county, it depends on what's offered in your city. It's great, but every plan is different, so you have to see what's right for you. All right, next slide, please. All right, so I'm just gonna review, because this is a lot of information So just before we move further, I just want to review the A, B, C's, and D's of Medicare. So Part A is hospital insurance, Part B is medical insurance. Everyone has got that, and that is what it's called, is considered original Medicare. Part C is a Medicare Advantage plan. It is private. It is offered through private companies, not through the government. Part D is prescription drug plans, also offered through private companies. And then lastly, Medicare supplement, which is not really part of the Medicare plans, but it helps cover the costs in original Medicare. That is why sometimes it's considered a Medigap. Next slide, please. Now, what should you choose? So again, I'm going to just go over the two benefits again. Option one was, the two options again. Option one is Medicare supplement, also known as Medigap, plus prescription drug plan, PDP. This will cover everything that Medicare covers and usually costs, so the Medigap plan costs around $200 to $300 a month. Drug plans are around $33 a month. And you have very little to almost no out-of-pocket expense. So every month, you know what you're going to be paying every month. This is how much, these are your premiums, and that's it. Everything else is covered. The nice thing is you can go to any doctor, anyone who accepts Medicare. No referral is required, so you can go any specialist and all throughout the nation. Now, option two is the Medicare Advantage plan. And that one includes the prescription drug coverage. So you don't have to pay separately for that. It includes everything that Medicare covers plus the additional benefits depending on the plan and the county that you're living in. Typically, the premiums are $0. I have seen them go up to $100 a month, but there's a majority of them are $0 premiums. They do have copays and co-insurances for your service. So it's kind of like a pay as you go. If you have to go see the doctor, this is how much you'll pay. If you don't see the doctor, everything else is, covered. And there is usually an out-of-pocket maximum of $7,550 in network. The downside to this is that you may need a referral depending on what plan you're in, HMO, PPO, or a POS. And you may only see in-network doctors accordingly. Next slide, please. Again, in both options, you will be paying Part B premium. You might not be paying Part D in one of them, but you'll be paying Part B. All right. So your decision in this matter is a very personal one. You and your spouse can be on two separate plans, depending on your needs. There are some questions you should ask yourself when considering what plan to take. What am I willing to spend on premiums, deductibles, co-insurances, and copays? Does the plan that I'm considering have all the benefits I'm looking for? How important is it to me to have a vision, dental, and hearing services covered? Am I okay with having a restricted list of providers and hospitals within a network? So as I had mentioned earlier, HMOs have a restricted network of physicians. And if you need extra or immediate care, that might not be the best option for you. Do I feel comfortable using this plan to manage my chronic health conditions that I have? So for example, if you have diabetes, there are certain plans that will provide a better formulary to cover more diabetic prescriptions, or certain specialists which are in their network that will help you in your overall care. So you need to make sure that even if you're picking a certain plan, make sure that plan is catered to your specific needs. Next slide. These are some additional considerations. Talking about special needs, some Medicare plans are specifically designed to help those with chronic conditions, like I talked about with diabetes or even heart conditions. You may be eligible for a special needs plan if you have Medicaid assistance from your state, so Medi-Cal or Medicaid, or if you live in a facility like a nursing home and need additional care. So these are called special need plans. And this is part of special need plans are a part of Medicare Advantage plans. They're a type of Medicare Advantage plans. Okay. Next slide. If you need help, you can go back to financial. If you need help paying for Medicare costs, there are programs that can help. The first and the most common is Medicaid, which is offered by the state, and it is based on your income. The next is actually most majority are based on your income. The Medicare Savings Plan. This can help reduce your Part A and your Part B costs. Next is Extra Help, which is also considered also called Low Income Subsidy, LIS. If you've heard of that, that is to reduce your medication costs. So this is specifically for our seniors who might be on some very expensive medication. A few slides ago, I spoke briefly about the coverage gap or donut hole. And if you find yourself falling into the donut hole in the early months of the year, and your prescription coverage jumps to prescription costs jump to insane amounts that you cannot afford, you can apply for the low income subsidy to offset your drug costs. And lastly, there are local assistance programs that you can look into and can be found at your local Social Security office. Next slide, please. Now, enrolling into Medicare. I just want to point out that there is a lot of information on Medicare.gov for a lot of resources, but talking to an agent can also help and help you go through the process very seamlessly. Enrolling in Medicare. So the initial enrollment period, as I had said before, is 3 months before you turn 65. You are eligible to start Medicare. You have 3 months before, then the month of your birthday, and then 3 months after. So you have 7 months to enroll in Medicare Parts A, B, C, and D. You can enroll in all 4 if need be. If you don't have employer coverage, it is best to enroll in Parts A, B, and D, or just enroll in Part C, which will cover all 3 of these, to avoid penalties. But do realize that if you don't join Parts A, B, or D when you are eligible, there are penalties for late enrollment. Next slide, please. Okay. So enrolling in Medicare after 65. So if you decide to delay your Medicare enrollment because, say, you have a creditable coverage through your employer, which you are allowed to do, you can delay your Medicare. If you delay it, then when you decide to retire, or when you do lose your employer coverage, you have 8 months to after you retire to start your Medicare. In this time, you can enroll in a Medicare Advantage plan or a Medicare Supplement plan as well. All right, next slide. There are lots of different timelines and deadlines for enrollment, which can get really confusing. So I'm going to just go through these 4 main enrollment periods. So initial enrollment period, IEP. That is specifically what I talked about earlier about right before you, 3 months before you turn 65, the month of your birthday, and 3 months after, the 7 months. That is your specific initial enrollment period, IEP. And you can enroll into these plans. Then there is annual enrollment period, AEP. AEP is from October 15th to December 7th every year. So in this period of time, you can enroll into a Medicare plan, Medicare Supplement, prescription drug plan, Medicare Advantage plan, all of these plans annually. You can change your plan. So if you decide to go with a plan and you were not happy with it, then you can change your plan during these 6 weeks every year, and your coverage will then start January 1st of the next year. And then there is open enrollment period. Right now, we are in open enrollment period, which is OEP. So OAP is when, say your coverage you enrolled into a plan in October or November, December, and your coverage started on January 1st. Now, say you're trying to use some benefits or going to certain doctors and you were not happy with your coverage. If you're not happy with the plan and you decide, I don't like this plan, I want to change it, I want to get out, and I don't want to stay in here for 1 full year. This is kind of like a tryout period. So you have 3 months to kind of try out the plan. And within those 3 months, if you don't like it, you can change one more time into another plan. So open enrollment is happening right now. And then the last part is the special enrollment period, which is SEP. And that is like when you lose your employer coverage. So you have those 8 months after that loss of employer coverage to get into Medicare or Medicare Advantage plans or supplements. All right, next slide. So I just want to talk about this one more time because this is very important. Enrollment penalties. If you do not join when you are eligible, and if you're not covered under a health plan, a qualified, creditable coverage, you will get a penalty for when you do decide to sign up. So Part A and Part B premiums, there's a 10% penalty for every year you didn't join. For Part D, it goes up by 1% every month you didn't have a prescription plan. So just a word of advice, when you're eligible for Medicare Part A, just sign up because usually it's free if you have worked or if your spouse has worked and paid into Social Security benefits. So Part A will be free, just sign up. Part B, if you are not covered under any other healthcare program through employer or otherwise, then sign up for Part B at that time. Do not delay it. And Part D, again, a lot of people they always forget about Part D, but you should not be without a prescription drug coverage. So either enroll in Part D or enroll in a Medicare Advantage plan that covers Part D coverage. Okay. Next slide, please. Actually, that concludes my my presentation, and I just want to. I'll take a few questions, but Bawa Shafiq, Sayyidina Ali Qadam Fadal Saifuddin Mola Tawalla Musharif, ne Umar Sharif, Neta Qayamat Daraz Karjo, Amin. And apna thanda saya ma muminin ne abad shad rakjo, and har kisam na muhammat si bachao, Amin.
Thank you, Inziban. I really appreciate that. That was a great presentation. Let's move on to the question and answer part of the presentation. If anyone has a question, we have received a few questions already. So I'm going to give the floor back to Inziban here, and she's going to just read some of the questions and do her best to answer them. And if you have more questions, please continue to text your questions to this WhatsApp number. So go ahead, Inziban.
Okay. One of the questions is, do I have to go through an agent to apply for Medicare? No, Medicare, you do not have to apply. You can apply by yourself. It's a fairly seamless process. If you can go through Medicare.gov, but it'll basically take you into SSA.gov, and you will make an account and you will just apply for Medicare parts A and B. You don't need an agent. An agent can just help you with the process. And then after you apply for Medicare, it's best to talk to an agent to see what your options would be best for your specific needs. I hope that answered your question. Next question, I have a question here saying, if I don't like my plan, can I change it in the middle of the term? So I believe this was kind of answered in the PowerPoint, but you do have the first 3 months of the year to change. However, if you have Medicare and Medi-Cal, Medicare and Medicaid, they have an election period, a special election period, where they can change their plan once every 3 months. So the first once every quarter for the first 3 quarters. And that goes for anyone with a health condition, a chronic health condition like diabetes or or a heart condition. So if you have those special need plans, the SNP, if those things apply to you, then you can change, you have an ability to change your plan. You will not be stuck. If another question was, if I have Medicare, which does not cover vision, what do I do? So vision can be covered in the Medicare Advantage plans. And a lot of people, I mean, if they don't want to take a Medicare Advantage plan, some people you can go straight to the doctor and pay cash and negotiate your own fees. However, if you have a Medicare Advantage plan, the eye exams and glasses are covered. A lot of sometimes it's up to like $200 per glasses and frames. Okay. Do all doctors accept Medicare? Most doctors do accept Medicare. I can't say all of them do. That is original Medicare. So that's one thing you have to realize, that when you have original Medicare, you have a little bit of more ability to go to a lot more network of doctors, because majority of them do accept Medicare. However, if you join certain plans, then you'll have to make sure that your doctor, that if you have a specialist or a primary care doctor that you have to go see, you have to make sure they are in network before you join that plan. So I highly recommend you do your research or talk to an agent that can do all of that work for you.
And Steven, let me actually ask as a follow-up to that question. Suppose that someone is in the hospital for a long period of time, and sometimes hospitals have lots of different, or relationships with other providers, labs, et cetera. I mean, can you assume that Medicare will cover all of those things?
So if you have original Medicare, so it will cover up to 60 days in the hospital. And after 60 days, there is a copay of $400 per day. And then that's up to 90 days. And then after 90 days, it's $800 per day. So it depends on how long you're in the hospital or skilled nursing facility, or hospice care, whatever it is. So all of that is kind of included in that. So that's why if you're someone who gets, who has a lot of health conditions and is hospitalized quite often, I would say, if you get the Medicare supplement plan, that gives you that all of that is covered. You don't have to pay those out-of-pocket costs or the deductibles, and you have the liberty to go to the doctor or specialist that you need to go to. Okay. One of the questions here, it talks about parents. A lot of these questions are about immigrating parents coming to the U.S. Now, if you're on a green card, you have to wait at least 5 years before you can be eligible for Medi-Cal or Medicaid. Medicare, it's a little bit tricky, because if they have not worked in the U.S., then they're going to have premiums that it just doesn't make sense to get right away. So first, I would apply for Medicaid, and then see what the Medicare savings plan programs are available for someone who cannot pay for those extra premiums. So the Part A premium is the $500 a month, and they will have to pay for that because they have not worked in the U.S. And so hopefully the MSPs, or the Medicare savings programs, can help pay for these things. If you are coming on a visiting visa, Medicare is not available for them. Medicare is only for U.S. residents or legal residents or U.S. citizens. But you can apply for traveler's insurance. And that will be another topic that we will be discussing in our future webinars. I'm just going to go over, there's one more question. I think there's still people who are a little bit confused between Medicare, Medi-Cal, and Medicaid. So I'm going to go over this one more time, because this is a question that's very common and it is very confusing. So Medicare is a federal program. It is a federal health benefit. Medicaid is a state benefit. So, and it's usually Medicaid is income-based. Medicare is usually with those three qualifying things, but it's majority of the time age-based. So it's, if you're over 65, you probably will be eligible for Medicare, which is the federal program. Medicaid is, again, income-based, and it's through the state. So if you are under 65, have a low income, but need health care, you can get Medicaid. If you're over 65, you can get Medicare and Medicaid, depending on if you can't afford, if you have low income as well. So if you're over 65, you can get the Medicare and you can get Medicaid because of your income. I think I've answered most of the questions on here. Yeah, I think so. So here is my personal information here, my email address. If there were any questions that I didn't answer, or it's more private that you want a specific answer for, you can email me or you can give me a call. I am available. And if you scan this QR code with your phone, it'll take you to a website where you can put in your information and I can contact you as well. So you can just put in your information, your contact information, and I will be able to get back to you. So either way, you can email me or call me or scan the QR code. And I guess that concludes our webinar for today.
Thank you very much, Intiman. Really appreciated that, the detail and, all the information. And it is a lot of information. And so that's why we are going to also have the recording of this webinar be available on our YouTube channel, which, as I mentioned before, is youtube.com/@SBMedical, or via our website, sbmedical.org. You can access the recording of this at any time there, and also we'll make the slides from the presentation available for download as well. So if there's nothing else that to cover, I think that we're good. So thank you again, Shukran Sagla, for joining us, and आखिर में आपने दुआ करिए कि आका मौला उमर शरीफ तराज क़यामत दराज करो. आमीन.
Amin.